We have a health alert to tell you about, a warning for anyone interested in cosmetic lasers. Lasers can be used for wrinkles, hyperpigmentation, rosacea, and also hair removal.
Yeah, but if used the wrong way, if things go wrong, they can burn permanently and damage your skin. KPRC2 health reporter Haley Hernandez shares one woman's warning after a treatment went terribly wrong.
And at one point, I could smell burning flesh.
Dawn Powell had almost flawless skin, but was eager to diminish rosacea-like redness. After going to a dermatologist for a few visits, she put her trust in them and unfortunately faced terrible consequences.
A lot of doctors I've talked to, they said they should have stopped right then and there. Just lowered it down, stopped it, done whatever, not kept going all over the face, and then repeating the same thing on the other side.
Since that traumatic experience, Dawn came here to Dr. Mirwat Sami for a corrective treatment.
Dr. Sami says this should never happen.
There are times when we have to tell patients, I can't use this laser as much as I would love to. I can't use this on you because I know that you would have consequences of hyperpigmentation, scarring. You turn, an aesthetic procedure into now a medical complication.
Here's what she says should happen for the safest experience. Go to a board-certified physician, consult with a doctor before the day of the treatment, and have a spot check done days before the procedure.
And I've had so many patients that come in and they tell me, well, I get this laser all the time. My doctor or my med spa doesn't spot check. It is our job at the end of the day to find the right laser treatment for the right patient. And that comes from knowledge of the laser, what it can do and what harm it can cause. And it comes from having that experience with skin types.
Dawn was so upset, she agreed to do this interview to let others know the questions she regrets not asking.
Don't necessarily assume because you had one laser treatment it's going to be the same. Ask what kind of laser it is. How many times has that doctor done that laser? Ask what was the best scenario you had? What's the worst?
Wow, just shocking to see that. So Haley's with us now, and this went terribly wrong. I do want to ask you, this procedure, was it done with the wrong type of laser, or what was the part that went wrong?
Yeah, so Dr. Sami tells me that that there are a variety of lasers, and she says that they are used for different types of procedures, different parts of the body, different pigments. If this had even happened to someone with a darker pigment, it could have scarred them in a way that would have just ruined their appearance. But yeah, she assumes that the type of laser that was used on Dawn was probably not for the face.
So it's good to do the work beforehand so you don't get that. But her face looks great now, so I'm glad that she's recovering from that still.
So she is using other corrective treatments now to try and undo those complications. But
which I'm sure is painful and expensive.
Yeah, exactly. And she's lucky to have made the recovery that she's made so far.
Incredible. Haley, thank you.